Okay, hi everybody. My name is Chris. I have my colleague Anais here with me today. We are very excited for you to join our Asthma Speed Talk so we can tell you a little bit about how we use some of our evaluation. We are with Health Empowers, a nonprofit here in Georgia. We focus on healthy behaviors, healthy environments for youth and families across the state. And today we are excited to share with you a specific activity that we like to do as a part of our evaluation efforts. You may do something similar, but if not, hopefully it'll jog some ideas for you so you can use it as well. All right, next slide, please. So a few things just before we get into this specific activity, the data dive we want to share. These are just some of the things that we've learned as we've worked with our partners here in Georgia about why to share the data back. Just first off, it's an equitable practice. We are fully aware that any and all data that we collect from our partners, communities, and sites, that the data belongs to them first and foremost. So by sharing the data back, not just collecting it, but sharing it back and closing that evaluation loop, if you will, it just helps to build process and capacity to put our sites and our communities in the decision-making driver's seat, if you will. We've noticed that when we do share specific site feedback and evaluation back with them, it creates deeper buy-in from the start. So rather than just sharing secondary data or other data that we have, as soon as we can share individual or site level data back, just deeper buy-in. It's a part of robust programming. Oftentimes it's easy to get caught up in just the delivery of the direct ed or the services. But sharing evaluation data back at the end and going beyond just kind of the pre-post results that we collect, but giving time to actually try to break it down and understand why the results are, what they are, it takes time. So oftentimes we're just so focused on getting the education, the direct ed in, that we may not leave time for evaluation. So it's just being purposeful about sharing it back with our sites. And then lastly, I'll just say that when we do a good job of sharing evaluation results back, when we involve sites and not just the planning, the implementation, but all the way through, it's just greater impact. We've seen that it extends beyond just programming, health behaviors, PSEs, you name it, it just all increases and enhances. Okay, if you will, next slide, please. Okay, so what we're going to do here in just a second, and Anais is going to go into specifics of how we like to do the data dives. But this activity specifically, we have found builds trust. So the transparency piece, the equitable practices I just spoke about, this is just a really good way to build relationships and build trust quickly. It's going to allow, as I mentioned, just to go beyond just handing them back results. There's key times and space shared for the inferences and why the data is. So it can all be for program improvement. And then the last part, the communicate piece, we have found using an exercise like data dives, it allows to find the places for program improvement, but it also is a chance to highlight the current assets that are already there in communities and sites that we serve. So it's a great place to communicate those across. All right, next slide, please. Okay, let's get to how we like to do the data dive activity with some of our sites. Because we oftentimes collect data pre-post, beginning of the year, we work with a lot of schools. So there's a gap of time between when we do pre-post measures. So whenever we do the data dive and we've given them, given partners their results back, we always remind them of when we collected the data, how it was collected, who it was for, just because sometimes they forget. So we just want to remind them the evaluation results and the activity we're doing. This is kind of how we arrived at these measures. The cool thing about the data dive, it can be done on an individual basis, just one-on-one, site specific or partner specific, or you can use aggregate data. I mentioned that we work with schools here in Georgia, so sometimes we work with cohorts and or districts. So whether it's site specific and you're doing it one-on-one as technical assistance, or in a training platform where we use it often, where there could be 3, 5, or 10 or more sites all together doing the data dive, it doesn't matter. The data dive is a really cool tool to use. So I'm going to turn it over to Anais, and she can share more specifics on what to do next with the data dive.
Thanks, Chris. So yes, after the initial introduction, sites then review their data, which again typically includes overall behavior and PSE outcomes. And like Chris stated, these data dives have been conducted using either site-specific or aggregated data within specific parameters. So for example, using all elementary level results or all district level outcomes from sites that are clustered within a specific location. The review is always conducted with Health Empower's team members to ensure that no matter how familiar with data the partners are, they're able to comfortably navigate the results in order to make their inferences. Next slide, please. After reviewing their overall outcomes, sites and partners are then asked to complete an activity that allows them to dive deep into their data and notice trends, outliers, improvements, and or areas that need additional support to relate it all back to their ongoing SNAP-Ed work. We'll dive into some specific examples of how this activity looks in just a minute. Next slide, please. The last critical step of the overall activity, this is really the so what aspect of it all. So in diving deep into their data, partners are able to see the bigger picture of the SNAP-Ed program, and that of course has encouraged additional buy-in into SNAP-Ed overall. Furthermore, by collaborating with our partners in the strategies within the decision-making process, we've been able to incorporate some of their programmatic details the sites themselves have outlined as crucial for success, thus building capacity for sustained efforts and for tools to assist towards the ultimate goal of self-advocacy for our partners. Next slide, please. So as mentioned earlier, here are some examples of the way the data dives have been conducted with our sites. On the left here is an example of when sites have used their individual level data to complete the activity. And on the right is an example of how an in-person training incorporated physical activity into the data dive itself while they were reviewing their aggregate level results. As you can see, both examples incorporate noting either directional or maintained differences within their behavioral outcomes. Additional processing questions are available on the activity, and they include things such as describing how your school health team encouraged and supported nutritional programming across the school year, or what strategies can be employed to engage additional buy-in for the programming. And again, just to sort of tie it all together, it's this combination of pulling inferences from their own data, along with the processing questions that we believe contribute to the noted outcomes that of course lend itself to sustaining programs that are truly driven by communities for communities and efforts to promote healthy habits and transforming environments for children, youth, and families. Next slide, please. So this collaborative evaluation practice between us and our partners has definitely allowed us to see sites take greater ownership in the SNAP-Ed process, outcomes, and impact. And we encourage any states or IAs to incorporate the practice if they can. Feel free to reach out to us with any questions or anything we can clarify. We'd be really happy to help. And thank you all for listening.
So good morning and good afternoon, everybody. I am happy to present on behalf of the Pennsylvania Supplemental Nutrition Assistance Program Education, evaluating the effective changes implemented during the COVID-19 pandemic. My name is Kasuma Schofield, and I have over 16 years of experience working for SNAP-Ed, where my primary role is conducting assessment and evaluation with a focus on high school students. I'm also a PhD candidate in the Department of Nutrition Sciences at Drexel, and I'm honored to be presenting on behalf of my advisor, Dr. Jennifer Quinlan, as well as our program director, Mrs. Judy Enslin. Our program provides services to over 70 sites in Philadelphia County. Next slide, please. Before we start, I'd like to introduce that we are 100% funded under the USDA's SNAP-Ed program. Next slide, please. Today, for our learning objective, attendees will learn how to successfully implement a SNAP-Ed program in a virtual manner and understand how to measure outcomes. Next slide, please. Part of virtual implementation requires taking a look at both lessons and activities. So let's explore how we did that. Next slide, please. So when the pandemic hit, the Drexel University Eat Right Philly Nutrition Education Program transitioned to a virtual programming. In our work, we proposed the following aim in order to evaluate the efficacy of virtual programming using pre and post testing in order to examine behavior change. So let's talk about what that means. First, we had to look at what we had available and what we would need to successfully teach in a virtual capacity. This meant transitioning items such as our activities, lessons, recipes, and PowerPoints into online compatible formats. We did this using Google Suite for most of our work, along with YouTube, Canva, Zoom, and any other programs that the schools felt most comfortable working with. We decided to ask, how effective are our lessons when presented in an online format? To do this, we replicated a study design from other high school studies that we've done on the same high school curriculum by using a YRBS survey that would be presented online to students. Next, we asked our coordinators to recruit classrooms for the study. We ended up conducting lessons virtually in 6 high schools and over 100 students. And although I do not have our results on this slide, I will tell you about a little bit about what our results showed us. One nutrition behavior did increase significantly, where the mean number of times students reported eating salad yesterday increased, providing a p-value of 0.03. And this is in line with what we have found in prior studies, where vegetable increase is often seen with our study results utilizing the same high school curriculum in person in past studies. Nutrition risk behavior improved from baseline to post-intervention, where a small number of students moved to lower risk regarding vegetable consumption. Specifically, a smaller number of students did not eat vegetables at post-intervention than at baseline, and an improvement that approached statistical significance at p=0.08. Risk factor calculation was utilized from the CDC data. Next slide, please. As a part of our additional analysis, you can go back to the previous slide. As a part of our additional analysis, we took a look at some statistics from our website analysis. So let's see what that outcome was. Next slide, please. In our website analysis, we took Google Analytics, which had been set up from the onset of our website development using Google Sites. We looked at some numbers pre and post pandemic with the aim to evaluate the Drexel Eat Right Philly website for changes in recruitment during the pandemic. We found the following outcomes from our study. In the pre-pandemic portion of our website visitors, we had 19 states reached, but during the pandemic, that number shot up to 37 states reached. Pre-pandemic, we had an average monthly visitation rate of 259. And just for your reference, pre-pandemic refers to anything that was March 1st of 2020 and prior. During the pandemic, which is everything from March 1st, 2020 and on, we had an average monthly visitor of 1,683 people. Pre-pandemic, I want to note that we did not use a newsletter, but during the pandemic, we decided to launch a newsletter in order to inform constituents of more information. And we did see an increase of about 40.7%. Next slide, please. So we did a further analysis on how the introduction of a monthly newsletter changed the reach numbers each month. And here you will see the month and the dates listed. For 2019 to 2020, we analyzed those as pre-pandemic with no newsletter, and then the visits from 2020 to 2021 included in emailed newsletters with tips, fun facts, and other nutrition topics. And here you can just see the percentage of increase that we saw when an implemented newsletter was shown. Next slide, please. So let's talk a little bit about what we've learned from our analysis as a whole. First, I want to comment on training staff members in technology. What we learned was that our staff needed training as well. Some of the programs were new to our staff members, and additional trainings were conducted in order to share knowledge. Of course, that included sharing resources as well. And I want to emphasize that we did not do this on our own. We swapped resources between subcontractors and even teachers in order to make a quick turnaround for the materials to be placed online in a virtual capacity. Something I really want to touch on is the increase in equity that this study can show us. We know how hard it can be to reach specific populations. In this study, we found that it informed us of several things. It informed us on better practices in situations where virtual learning is a more effective tool. Such issues such as participants who cannot travel, rural or tribal nations, and those with physical limitations could benefit from increased access to nutrition education through virtual implementation, increasing the reach of SNAP-Ed to more vulnerable populations. I once heard a story from a participant who said that providing cooking workshops and demos are all great ideas, but we need to take a look at our population into account. Many caregivers and adults are simply unable to attend, he said. Many adults in the community are commuting 3+ hours to and from work. Sitting in a class after all of that would leave them with no time to cook in the first place and would just cause a burden on the community members. By providing online nutrition education, we could breach this barrier in a small way. Imagine how we could change this by simply providing a food box and an interactive cooking demo virtually alongside our populations. We must continue to provide easier access to participants. So let's talk a little bit about utilization of our available resources. We definitely learned a lot about Google Suite capabilities. Additionally, we used the resources that we already had. One project that we did in the program was a pre-recorded recipe video and recipe voiceovers for our PowerPoint presentation. And finally, successful virtual implementation is possible. Continued interventions are necessary and research needs to be invested in. This is one small study that we conducted, but can we imagine the impact of multiple studies to show additional positive outcomes in facilitating this manner? Next slide, please. Lastly, I'd just like to thank our wonderful team for all of their hard work. Next slide, please. Oh, sorry. And if you need to give, there should have been contact information on that slide, but if you need to reach me, you can reach me at kkb32@drexel.edu. And thank you for your time.
All right, good afternoon. Thank you for having me, and my colleagues are joining me, Ms. Natalie Owens and Dr. Karen Frank. We are from the University of Tennessee Extension Program, and we'll be talking today about using focus groups in formative needs assessment and in evaluation. Next slide, please. So today we're going to look both at why using focus groups is a good idea for evaluation and formative needs assessment, describe the process of working specifically with third-party vendors to conduct focus groups, and then providing a bit of our focus group findings that we have that we've encountered in the last few years. Next slide. So why focus groups? Nutrition topics are really great fodder for focus groups because they have a little bit less of a sensitive nature. Focus groups are generally about 5 to 8 participants, although you can get some good data when they're about 10 participants. But one of the goals of our program in particular, and of course SNAP-Ed in general, is embedding equity into our programs. And to do that, we found that centering participant voices helps us inform our programs. We also know that generally SNAP-Ed in Tennessee is a potentially really powerful intervention, but we've been reaching mostly US-born and English-speaking participants generally. And so when we use focus groups, we can understand more niche needs of our audience. Our audience is SNAP eligible, but it is not homogeneous and is very diverse. And so we can understand the specific needs of various audiences using a focus group. It also allows people to work off of each other and talk. So participants engender discussion and new ideas are formed. And this is in contrast to interviews that are done privately. You can still get really great information from those. It is an absolutely appropriate method to use for evaluation, but focus groups get people talking. It also gives you some time for in-depth conversation and consideration of materials. We were able to ask really important questions of our participants, like how they want to receive information about nutrition. So lots of information in the practical sense. And then we got a lot of nutrition related information from them. So how do they value health? What do they think it means to be healthy? And then there's specific nutrition related requests. Next slide, please. So this is our timeline. Of course, this spans from before the pandemic to after. So we had a focus group project with Latine audiences in 2019, and this was qualitatively different than the focus groups that we conducted in 2020 and beyond. So in 2020, we did a high school student focus group. And then in 2021, at over 10 months time, we did refugee interviews and focus groups. And I'll explain a bit more about why the refugee focus group project changed. Next slide, please. So I'm going to talk a little bit about our methods and main findings. We were really careful in each instance of conducting focus groups to target populations in both rural and urban areas. Tennessee has 95 counties, we have 3 regions, and we have 4 major metros and some bigger cities, but we also have a lot of rural areas. And so we wanted to be really intentional about recruiting participants from all of those areas. And so that is true for all 3 of these focus groups. The focus group with Latina audiences, and actually with all of them, was done with a third party. They were different third parties, however, for each of these. So the Latina focus groups, we had 118 participants over 7 counties. We had a Spanish speaking facilitator. And so we were able to include participants who spoke English and who spoke Spanish. And we found that they were really interested in getting nutrition information from social media, and that social media was a great way to advertise our SNAP-Ed programming. We also found that they wanted to learn recipes that were like the food that their children were eating in school, which was actually surprising to us. And we also had them look at some of our materials. And, you know, they sat down with, we have a celebration, a Latina celebration cookbook that specifically has Hispanic recipes in it. And so they looked through it and gave us information and feedback on all of those. So in that sense, it was an evaluation of material that we had already developed. They told us that we needed to adapt those a bit more, that translating wasn't enough for that cookbook and for some of our other materials. For instance, the translation of the word value, we use value a lot when we're talking about food resource management or shopping. It didn't translate the right way to them, and it was more like a family value, like the word meant more like a family value. And so we needed to translate those words differently. And they also asked for our pictures to change. Our high school focus groups were conducted during the height of the pandemic. So they were very difficult to do. We used a third-party vendor, and it was of much less quality than our other focus groups. So we had 30 total participants in 5 focus groups that did spread across rural and urban areas. The research question and the interview guides were a bit more, we had less control over those with this particular vendor. And so the data that we have from that is far less useful. But we did find most of our learning from that focus group was actually how not to, engage with a third-party vendor. And how to do better focus groups. But a lot of it also had to do with the pandemic and having to reach people virtually. And the schools were really, of course, difficult to get into in 2020. And then our most recent focus group study was with refugees. We engaged with a third-party vendor, market research firm, to conduct those. We had 7 different focus groups with 24 participants spanning 5 languages. And so these courses were a bit more time intensive in terms of finding interpreters. Now, the vendor that we found was the same actually that did the Latina focus groups, and she was Spanish speaking, but they did not have internal capacity to translate the focus group content. And so they had to work really hard to recruit participants and then also to conduct the actual focus groups. The next slide, please. So some practical tips and considerations if you want to do this. The cost can be very high when you use a third-party vendor. It was anywhere between $15,000 to $25,000. When we name the vendor in the proposal, we're able to move a little bit faster in our timeline, but you have to look at your internal guidelines and rules for doing things like that. We also had to bid out one of these projects, and that can add about 3 to 4 months because of course there's a committee involved in that. It's also important to consider where you're going to fund this from. So in Tennessee, we do get to carry over our unspent funds in SNAP-Ed. And so we used those funds to conduct these focus groups, but that shortened our timeline because of course we needed to spend it within the fiscal year. And it's also important to consider your role of coordinating and guiding the focus groups and how involved you want to be in the development of the instrument used in the focus group and, you know, all the steps in between. So how involved do you want to be? And this lends us to our next slide of if it is even appropriate to use a third-party vendor for the research question or the evaluation question that you want to ask. So you could do focus groups internally, but of course you need to consider the time that you have to do this and your other obligations in your work. Third-party vendors can do a lot of things and spend a lot more time on these, and actually getting the refugee focus groups done in 10 months is something that might have taken us 2 to 3 times as long to do internally. They can conduct really quality focus groups with target audiences in a reasonable amount of time, but if you want to have a lot of say over what's going on, you might want to consider doing the project internally. The budget is also a really huge consideration because it can be, you know, upwards over $20,000 depending on how much, how many people you want to reach, how long the project is going to take, and then if there's any travel involved. And if you have a lot of expertise in-house, it might be good to conduct these focus groups internally. Next slide, please. So some of the benefits and challenges, of course, so cost is another one. That's definitely a challenge, but it is a way to spend, carry over money if you have that. The time can take a long time to do this internally, but externally can move on. The methods often also reflect the barriers. So in a lot of these focus groups, we were looking at the barriers and facilitators to nutrition education. And of course, especially with the refugee focus groups, recruiting the participants to the focus group themselves, the challenges there reflected the challenges in recruiting them to our classes in Tennessee. And of course, we did encounter variable quality among the vendors. We got really long reports, and so you still have to weed through that information. Next slide, please. And the most important part is using our findings to inform practice. So of course, learning and conducting evaluation is really interesting, but the most important thing is to use these results to make changes and inform program priorities. Thank you.
Hi, thank you so much for having us here today. So this is our development of a single evaluation plan in SNAP-Ed, Texas. Next slide, please. So we all know SNAP-Ed funds implementing agencies or IAs to implement nutrition and physical activity education programs and are expected to use evidence-based projects and interventions and are required to report results to the USDA or FNS. Next slide, please. In 2017, UT Health was contracted with the Texas Health and Human Services Commission, or HHSC, which is the Texas state agency, to develop and implement a formal statewide evaluation plan. At the time, there were only 7 IAs when that happened, but today that number is doubled. Despite all IAs broadly targeting nutrition and physical activity, programs varied in size, coverage, number of projects or curricula, scope of activities, and type of activities. While some of the IAs had in place evaluation instruments to assess outcomes, these instruments, were not always streamlined or comprehensive, and sometimes even varied within IAs across program to program. Moreover, from the state's point of view, the lack of standardization made it extremely difficult to produce program effectiveness outcomes for key indicators at the state level that could be reported to funders as part of funding requirements. Next slide, please. To begin, we had to strategize the best way to build an evaluation framework for Texas SNAP-Ed. The model we created for ourselves is demonstrated on this slide. During this presentation, though, we'll only be focusing on the evaluation tools review and the needs assessment. Next slide, please. So we created a 2-stage needs assessment. In the first stage, we had to understand the organizational structures within which SNAP-Ed implementation, evaluation, and reporting took place. IA participants, implementers, and leadership completed surveys and semi-structured interviews with our team. In the interest of time, I'm going to give a quick recap of what we found. We interviewed key agents at different levels in the IAs and found that evaluation gets lower priority and lower resources than program implementation. In addition, challenges faced at each of these levels were different and ranged from strategic to tactical challenges. If you're interested in any of this work, please reach out to our team so we can talk about it. In the second stage, we assessed all evaluation methods and materials by conducting a thorough review of all program curriculums and evaluation tools used by IAs. We then compared and found common metrics used in their programming. Next slide, please. In order to provide relevant feedback for the IAs, indicator coverage was assessed by individual IA to determine the breadth, depth, and relevance of program goals in accordance with the SNAP-Ed framework. While each IA's programs were not directly evaluated as part of our project, their use of indicators and outcome measures was documented on both a collective and individual level to aid in the understanding of the current status of indicator coverage. We did this by collecting all curriculums and evaluation tools from the IAs for each SNAP-Ed funded program. Each survey question was matched with a corresponding indicator from the framework, and frequencies were calculated. Only short-term and medium-term outcome indicators were inventoried for this part of the process. Next slide, please. Although all IAs reported varying degrees of concern with incorporating evaluation into their programming efforts, it was clear that there was some degree of evaluation being carried out by several IAs. However, these approaches were scattershot and there was no underlying coherent structure or process to different evaluation efforts. Next slide, please. Because all states are strongly encouraged to measure 4 core indicators of changes in the medium-term components of the SNAP-Ed framework, we focused on MT1 through MT3. Across all IAs and often within IAs, different programs may target the same behavioral outcomes. Based on what we learned from the primary data collection, secondary data analysis, and the assessment of evaluation methods and materials, we realized that an evaluation plan for SNAP-Ed Texas would need identification of a limited, manageable set of indicators and a standardized set of tools to measure outcomes while limiting burden to IAs, staff, and participants. Our team identified the most commonly used outcome measures and selected corresponding questions from validated sources for each of these for use across all IAs. Next slide, please. After deciding on priority outcome measures to report at the state level, our team created this tool to use with new IAs as they onboarded or when current IAs added any new project or curriculum. We use this tool in consultation with IAs and after reviewing curriculums and evaluation tools, and then we mark which of the priority outcome measures will be included in their survey. Next slide, please. Then at the end of the fiscal year, data is aggregated at the state level for reporting to HHSC. Our team only reports on the priority outcome measures that were most widely covered by the different IAs. Next slide, please. All of our efforts were to ensure that HHSC receives data and information required by FNS in a clear and standardized format, while still supporting the IAs and their different needs. It has taken some time, but all IAs are now accustomed to our surveys, making it so our process flow for obtaining and reporting on individual outcomes continues to improve in its efficiency. Our end goal for program evaluation is to take on much of the annual reporting burden of evaluation off of the IAs. Next slide, please. All of our work has resulted in the process flow, in this specific process flow when adding any new IAs or new programs. We first work with the IAs to review their materials, we complete the outcome measures table with them, and then we create their specialized survey. Next slide, please. Given the number and extent of challenges we faced in this process, our recommendations for any state with multiple IAs would be first and foremost to build a relationship with the IAs. We found success when we took on the most painful processes for the IAs and showed them our final results at the end of each fiscal year. Our team was very, very transparent and kept open lines of communication with each IA to ensure we could address barriers or issues as they arose. Even though we were developing a standardized evaluation plan, it was best for all parties involved if we provided flexibility where possible. Though all of our data is currently stored and collected in pairs, we've been able to incorporate pen and paper surveys when necessary, and we allowed for a certain level of customization for the surveys. Some of the IAs included questions in their own surveys that were not needed for state level data, but were very important for their own analysis. Being flexible in this way allowed for a greater number of needs to be met. Finally, we do recommend a standard collection of questions per indicator or outcome measure, which would allow for better statewide comparisons and shorter surveys. Next slide. So if you have any questions for any of this work, please reach out to any one of us on our team, and we'd be happy to talk about our results. Thank you.
Snap Ed friends. My name is Laurel Jacobs from the University of Arizona, and here today as well with me are Teresa LeGros and Greg Goodman to talk about how our team explored one of our first purposeful steps toward equitable evaluations using equity gap scores. Next slide. Our team of trained evaluation researchers evaluate Arizona Snap Ed, known as the AZ Health Zone, which has been our core mission for the last 8 years, and hopefully for many more to come. While equity was not built into the Snap Ed program from the ground up, the program, as well as our team, has been taking steps towards explicitly addressing equity. Next slide. We decided to start with equity gap scores, a tool we learned about while taking the We All Count organization's data equity workshop in 2021. Next slide. In this data equity framework, equity gap scores are used in the analysis and interpretation phases of research or evaluation, although later we'll explain other stages where it is also relevant. Now I'll turn things over to Greg. Next slide.
Thank you, Dr. Jacobs. So to use equity gap scores, we can separate categories of an equity-related demographic linked to our outcome of interest. We can then analyze for each category separately, another foundational principle of equitable evaluations. Next slide. In doing so, we can generate a resulting ratio that reflects the potential equity gap between the highest and lowest value outcomes. The higher your resulting gap score, the more potential there is for an inequity between groups. Next slide, please. In this example here, we have a demographic, the schools, and an outcome of interest, veggie intake. Take a quick look before we go on. Next slide, please. We can see that on average, 20% of students ate at least 2 veggies daily, but veggie intake varied across schools. Next slide. You can calculate the equity gap score between schools by dividing the highest scoring outcome, here for the Cochise School at 32%, by the lowest scoring outcome, the Canal School at 13%. Next slide, please. Once we calculate that ratio, we find an equity gap score of 2.5. Remember that a value greater than 1 indicates a potential equity gap. Next slide, please. The interpretation then is that the percentage of students eating at least 2 veggies per day is 2.5 times higher in Canal School than in Cochise School. So there is a potential for inequity in this outcome between groups. And now we'll go to Teresa. Next slide, please. Take it away, Teresa.
Thank you. So what do these equity gap scores really mean? This figure from San Bernardino County's Advancing Equity Report shows that as the score itself increases, there's an increasing potential for inequity. Next slide. It's easy to interpret a 1. That means no difference was detected between groups. But what about a 9, a 3, a 1.5? Although it would be nice, there's no absolute way to interpret the numbers. They're relative. Specifically, they're relative to your own data set. Next slide. Here, our friends at Advancing Equity shared equity gap scores for different racial ethnic groups across 17 indicators. They color-coded from green to yellow to red. The scores reflect higher potential inequity. Next slide. Zooming in, the highest red level of inequity is for juvenile arrests with a score of 10. The lowest green level of inequity is for prenatal care with a score of 1.1. So having a range of indicators can be helpful when deciding what your numbers mean. Next slide. Now, imagine you're doing direct ed and ask class participants about their behaviors. You calculate these equity gap scores for 2 groups. Your scores range from 1 to 1.9, and you wonder, is the 1.9 worth addressing? The 1.7? Just because we don't see a 10 or 20 here doesn't mean nothing's going on. After all, when an outcome for one group is 1.7 times higher than for another, something may be afoot. But whether that something is worth addressing is really open to interpretation. Here, if the 2 groups attended different classes, you could emphasize veggies more when teaching the group less likely to buy and eat them. Next slide. Now, what demographics can we use with equity gap scores? We most often see race ethnicity, but our demographics depend on context. You might explore gender, age, income, or participation in federal programs, or geography, especially when it can influence food or physical activity access. Consider which demographics make the most sense for your program and ask yourself, at what level will you collect the data? Is it for individual people, sites like schools or retailers, or sectors like zip codes or counties? Next slide. In this framework, notice equity is built into every project phase. You'll want to identify and collect your demographics early on, and that means considering any data collection barriers as well. Back to you, Laurel. Next slide.
Thanks, Teresa. I wanted to share another SNAP-Ed example from our project. In our first year using equity gap scores, we analyzed a small sample of adults' fruit and veggie intake related to whether they reported participating in SNAP. We found an equity gap score of only 1.1, suggesting that inequity was unlikely in this outcome between the groups. Next slide. In year 2, we evaluated a different group of participants. We found an equity gap score of 1.5, a score higher than the year before. This underscores the importance as well of tracking changes in potential equity gaps across time. Next slide. Our team continues to explore equitable evaluation practices, and equity gap scores set us in the right direction. We leave you with an encouragement to consider how equity gap scores might apply to your programmatic or evaluation work. And we would like to thank We All Count for the methodology behind the equity gap score. Thank you.
Thank you to that block of presenters. We're now going to move on to our equity block of presenters.